but typically a lot of people feel comfortable. And then the last couple of weeks, they really start struggling and they go on Reddit and they talk to their friends and they figure out, oh, I'm not doing what I'm supposed to. Pharmacology is something you can raise points literally overnight, because if you don't know antibiotics, if you don't know about fluoroquinolones and about penicillins and about the MOAs and adverse effects, how will you get the answers on the exam? Many of you are pushing to learn epidemiology and biostats and genetics and inheritance patterns and stuff that, yeah, it's legit, but there's a lot of points that you leave literally on the table. So I'll give you an example. Do you guys know the TB drugs? Well, there's 5. There's rifampin, isoniazid, pyrazinamide, ethambutol, streptomycin. We use a mnemonic RIPES, R-I-P-E-S, right? RIPE regimen. My smiley face, there you go. Smiley face from the Midwest. So the RIPES regimen, right there, there's 5 drugs. That's cool, right? All right, so 5 drugs have 5 MOAs. The 5 MOAs have also adverse effects. So if you know those 5 drugs, there's one specific mechanism of action for each one, and there's multiple adverse effects for each one, you're pretty good. But the problem is, if you don't know the drugs, then we're in trouble, right? So when I talk about tetracycline, you know, it causes issues with teeth, right? You know, if I tell you about certain teratogenic drugs, I know during endocrinology, we talked about PTU and methimazole. Do you know which one you can give in the first trimester when it's safe? P for primary, P for PTU, okay? Methimazole is dangerous the first trimester, pretty good second and third trimester. So when you're studying, you need to focus on where you can get points fast. An example that I give, I don't know what specialties you guys want to do. Everything is beautiful. I loved ER. I was in IM for a long time, but if I had to do it again, I would do either ER or surgery, because I want results fast. I want to see things immediately happen. That's that's what I like to do. So in the ER, patients come in, 12-hour, you have 12-hour sets, you're working for 12 hours. Patient comes in, they're unstable, you stabilize them. Surgery, something's broken, you fix it. They're bleeding, hemorrhaging, you fix it. Other types of medicine takes a little longer, more maintenance, right? Check the calcium, the levels, and everything else. So why I bring this up? I bring this up because majority of you are hunting to learn everything. This exam is not meant for that to happen. If you're trying to cover everything because you're stubborn, because I was stubborn, you will not succeed, because it's too much to learn, too much to understand. I know you might say, Stavro, but what do I do? You're telling me all this. What do I focus on? Well, why do you think I create these sets, these AMBOSS questions? Why do I put my time in doing these live sessions? Why do I put my time in creating those QBank videos that you should be watching? Because I'm showing you where you should focus your attention. If you're everywhere, you're doing something wrong. You shouldn't be everywhere. You should say to yourself, I've accepted that certain things I just can't do, certain things I just don't get. But how many times you make silly mistakes? How many times you're like, methotrexate, metformin, I know those drugs, I just don't know the MOAs. Shame on you. You should focus on that. I tell you shame on you purposely, because you have to be able to differentiate these kind of conditions and drugs, because they're easy. Because if I tell you thyroid cancer, there's only 4 of them. Know 4 of them. Know a little bit about each. But some of you might say, I keep getting tripped on histology. I don't know about you. I'm stubborn.